Assalamu alaikum. Today we have this denture. It's opposing natural teeth. So we have an interrupted occlusal table in the lower slightly. So we're going to follow what we have in terms of occlusion. We checked in centric occlusion, and we found that all posterior teeth had functional contacts with the lower. Okay, this is now the excursion colors. We found that we have here a heavy color. Okay, and this is on the non-working cusp. So how do I change it? How do I do it or perfect it? Take this out, okay? Just take it out with a knife or scalpel. Just take it off. You will find that there is a hole of wax here, okay? Melt the wax buccally. So the hole is an empty hole of wax. Melt the wax buccally here. Then put the tooth back. Now these will go back to their original position, but this one now is over molten wax. So press it inside. So what are we going to do? We're going to do the curve of Wilson.
Oh, Wilson.
Lateral curve. Okay. So curve of Wilson. So this six and this six now they are on both on the table. When we put them on, check them on the table, they are both on the occlusal table. I want to raise this to create curve of Wilson. So this is how you do it. The other side, also we have these two non-functional cusps working. I know that the technician followed the lower occlusion, but even when we follow the lower occlusion, we leave some freedom for lateral excursions. So once more, we're going to do curve of Wilson on this tooth and this tooth. We had another problem. When you remove the denture from inside the patient's mouth, this lateral was out of wax, had gone buccally or labial. The reason for this, it was involved in a heavy incisal guidance, okay? But what could we do? We have the lower teeth irregular in form, and some of them have overrupted because of the periodontal disease. So what our solutions are, I'm noticing where are the heavy contacts on these teeth. I find that the wax here is involved in the incisal guidance, so I'm going to reduce the wax here. I'm going to reduce the wax here, and I'm going to tilt maybe the labia, the gingival part of the lateral, tilt the tooth slightly more labially. So see this palatal part? I'm going to push it a bit more labially. So try to create something like this. So by this, I'm avoiding the heavy incisal guidance that's causing the dislodgement of the tooth out of the wax. Now in wax, we have a dislodgement of the tooth, but in dentures, we will have a dislodgement force fulcrum where it might produce a reduction in posterior retention. You know how that works. Because if we flip the denture like this, what will happen to the posterior? It goes upwards. Okay, so I'm reducing the posterior retention. So what are we going to do? We're going to reduce the areas of heavy incisal guidance. These are on the wax here, on the wax here, and slightly on the palatal. Just push this tooth like less than half a millimeter labially, the gingival part of the tooth. So what are we correcting once more? The non-functional cusp here, the non-functional cusp here, the heavy incisal guidance here, and the non-functional cusp heavy contact here. These are excursive movements. We need balanced movement where we have the colors all together, not heavy on the non-functional cusps. Okay?